Good afternoon and welcome to the February 21st Community Update. My name is Stacy Wood and I've been with you for a whole year now as the Public Information Officer for Buncombe County Health and Human Services, the lead agency in the COVID-19 response. Today's presenter is Stacy Saunders, the Buncombe County Public Health Director. As you know, the Spanish version of this update can be found on our Health and Human Services Facebook page at BCHHS. And all of our community updates can be found later on this afternoon at the Buncombe County YouTube channel. And we'll go ahead and get started with an update from Stacy Saunders. Good afternoon and thank you for your time as we provide the COVID-19 situational report and vaccine updates. Let's begin with our indicators this week. As of today, 15,120 confirmed COVID-19 cases have been identified in Buncombe County since the pandemic start. 289 COVID-related deaths have occurred in our community. Currently, we are seeing about 66 new cases per day enter our public health workflow. Our new cases per 100,000 indicator continues to show a steady and consistent decline since the new year, falling about 57% since then. Our percent positivity is currently 3.7%. Our community has not seen a percent positivity this low since about 1 week before Thanksgiving. Regional hospitalizations also continue to show a pronounced and consistent decline over the last several weeks. While our local trends continue to move in a favorable direction, the decline in new cases of percent positivity comes at a time in which our country has just reached 500,000 COVID-19 related deaths. This is a sad and lamentable milestone. It is a stark reminder that while we are seeing improvements in cases, this is not the time to cut back on the preventive measures that matter so much right now. Help us continue to fight back COVID-19 with wearing your mask, washing your hands, and keeping your distance. We need your help in practicing these 3 simple acts while vaccine rollout continues. And speaking of vaccine rollout, as of yesterday, 47,523 total vaccines have been administered in Buncombe County amongst all approved vaccine providers. 65% of these are first doses and 35% are second doses. Also, as of yesterday, Buncombe County HHS and our partners in emergency services have administered 25,502 doses since beginning on December 22nd. Almost 17,000 of these are first doses, and the remaining portion are second doses. For the last 3 weeks, we have received a baseline allocation of 1,950 doses. This was based on the expectation of 5 doses per vaccine bottle. Beginning this week, our baseline allocation will be 2,340 doses. This may seem like an increase, however, it is the same number of vials as the previous 3 weeks, but now is based on the expectation of 6 doses per vaccine bottle. This week, we will be receiving 300 additional doses from North Carolina Department of Health and Human Services for improving the equitable distribution of vaccine to marginalized populations. With this special equity bump this week, we will be partnering with Tridestone Missionary Baptist Church and Western Carolina University to hold an event hosted by Tridestone in order to better meet the needs of our historically marginalized populations. In addition to this special equity event, we continue to run our first dose operations from the AB Tech site with our baseline first dose allocation. Additionally, we continue to provide second doses at Reynolds High School. We continue to vaccinate those in groups 1 and 2, healthcare workers and individuals 65 years and older. Our vaccine supply was not significantly impacted by the delays last week. Our shipment last week arrived 2 days later than expected. Appointments last week were not impacted by the delay, but were rather impacted by potential winter weather here in the area. The appointments that were canceled last week were rescheduled for this week. We have already received our allocation scheduled for this week, and therefore expect no appointment impact this week. Beginning this week, school staff will become eligible for vaccine. Based on the direction of local leadership, Buncombe County HHS will implement a hybrid plan that will allow for vaccinating school staff and continue vaccinating those in Group 1 and Group 2. Using only one tray of vaccine each week, Buncombe County HHS will schedule school staff identified by each school system as interested in receiving the vaccine. This will include public, charter, and private. This week, school administrators will be providing Buncombe County HHS with lists of school staff who have expressed interest in receiving the vaccine. Our schedulers will use those lists to schedule about 1,000 appointments each week for school staff, prioritizing first school-based staff and then district or administrative staff after that. Please note that it will take several weeks to complete the school staff based on one tray per week. The remaining allocation that we receive weekly will be used for general population meeting the eligible groups that are open. The deadline for the school list to be submitted to Buncombe County HHS is close of business this Wednesday. If a school employee misses the deadline to be placed on that list by their school administrator, they will be directed to the Buncombe County wait list for Group 3 when it opens on March 10th to frontline essential workers. Our partners at MAHEC have received vaccine doses as well this week, and with part of their allocation will be assisting in vaccinating child care facility staff as part of Group 3 beginning this week. We are very thankful for MAHEC and the Buncombe County Partnership for Children for their assistance and teamwork in providing vaccine. Currently, we are scheduling in the 10,000 to 12,000 range on the county's wait list, leaving still about 40,000 people still on the wait list. You can find updates regarding the wait list at buncombeready.org. We are hearing from some folks who are on the wait list that they have been able to receive their first dose of vaccine from one of our other providers in the area. And as more vaccine providers like Walgreens or our partners at FQHCs are added to our community, we are delighted to hear about the increased opportunity for vaccine distribution. If you have received your vaccine elsewhere and would like to be removed from our Buncombe County wait list, please call 828-419-0095 to inform a team member that you would like to be removed from the wait list. And lastly, with much focus on the COVID-19 response that has turned to vaccine rollout, I do want to inform the community that after many weeks of low turnout at our Buncombe County testing site at AB Tech, we have decided to sunset the testing operations. This change is effective immediately. In anticipation of the county's decision to reduce our testing operations, Buncombe County HHS and Emergency Management have worked with partners at North Carolina Department of Health and Human Services and one of their testing vendors, StarMed, to establish a StarMed testing site in Buncombe County. StarMed began providing testing in Buncombe County on February 4th at Buncombe County Sports Park. Individuals who are showing symptoms or believe they have had close contact with COVID-19 should get tested. You can visit the Find My Testing Place website to find a testing location near you or visit starmed.care to register for the Buncombe County Sports Park testing site. I want to personally thank our Buncombe County HHS, Emergency Management, local fire department personnel, and other volunteers at the testing team for their efforts the last several months. Many of these same folks on the testing team have also been playing an integral part in our vaccine efforts, working very long hours and weekends, sacrificing time with their families and loved ones to provide services to our community during this global pandemic. Thank you so much for your dedication that you have shown and continue to show in fighting the pandemic. In summary, our trends continue to improve. This is a welcome sight after several weeks of surging cases and rising community transmission. Our vaccine operations have successfully vaccinated tens of thousands of individuals. While vaccine supply remains low, more providers are being added to the community as we continue to vaccinate groups 1 and 2, and now school staff are eligible as the first population in Group 3. While vaccine rollout is underway, it will still take a while for our community and our state to receive sufficient amounts of vaccine. In order to continue fighting COVID-19 and reducing the spread in Buncombe County, please continue to practice the 3 W's. This goes for folks who have been fortunate enough to receive the vaccine. Though you may have received your complete vaccine series, not everyone has. And until more of us have our complete vaccine series, it will remain immensely important to wear that mask, wash those hands, stay 6 feet apart, limiting our interactions with people outside of our household. These precautions are making a difference. Please do your part every day. Thank you so much for your time today. Have a great afternoon.
So before we go, we'd like to say thank you to our American Sign Language interpreters and our simultaneous Spanish interpreters who have been with us since day one. They have been instrumental in our language access efforts related to the COVID-19 response. We will continue to communicate regularly about the vaccine rollout and COVID-related information. Please visit our website at buncombeready.org for more information. Thank you for practicing the 3 W's and for all that you have done here in Buncombe County to care for each other.